All this is Dr. Mobeen Sayyed from Drbeen.com. Welcome to one more show. So instead of just doing a simple chit chat, we can do that talk as well. I wanted to go over the Israel's data together, and credit to David, my friend from Israel, who is here in San Jose. I went over some of the data with him. I usually just bug him and say, David, I have this question about this graph. Can you please translate it? Or can you please tell me more? Or this is what I think. And so David is kind enough to give me his time and help me not only translate, but wrap my head around the numbers too. So with this, thank you very much for being here. Let's start the discussion. So this is Drbeen.com. And here is the Israel's, I believe it is their health ministry's dashboard. It is usually in Hebrew. I have set it on Google to translate, but there still are words which I did not understand when they got translated because Google didn't do a medical translation. So then I go back to David and I say, David, what does this word mean? For example, yesterday, when I was looking at it, there was a word called vaccine with thirst. So, and then there was another word that said vaccine with impulse. So I suspected it is something to do with the booster, but I did not know did it mean 1 dose, 2 dose, or booster. So I asked David about it. So with this, let me see if I can. I don't know if the size of the screen is good enough, so I'm going to try to increase the size and see if we can go over this together. So the question in my mind, and this is a question that is sent to me many times, or I see that in tweets, that vaccines are not doing well in Israel, and the Israel's infection rate and the deaths in Israel are proving that. So I wanted to make sure that we see it. My conclusion so far is this. In terms of number of cases, vaccinated are almost without the booster dose, that is 1 and 2 dose vaccinated. They seem to have almost similar number of infections compared to unvaccinated in terms of rate. I'm not talking about the absolute number. The problem with the absolute number is, let's say the unvaccinated people are 100, and out of 100, there are 2 people who are sick. And let's say vaccinated people are 300, and out of them, the number of people sick are 3. Then we have a difference in their rates. So the best way to compare them is with the rate. So we look at both the data together. What I saw here is the number of cases with fully vaccinated and the unvaccinated seem to be the same. However, number of cases with boosted vaccinated, 3 doses, are very different, significantly different. And if you go to severity and the death, then the number of cases with severe disease, they are very different in vaccinated with booster or without booster. Similarly, number of deaths with booster or without booster compared to unvaccinated are very different. So my request to you is this: let's do a small experiment. Have your opinion that what were you thinking from the medias and from the rumors and from the tweets. Have vaccines failed in Israel, not failed in Israel? What is it that is in your mind? Maybe even type it in the comments, and then let's look at it together. And correct me if you think that I am not looking at it the right way, but let's do this more of an exploration instead of me presenting. This is a chit chat still. So let's start from here. I'm going to try to make this bigger. So this one, I wish this header here could disappear, but it will not if I make it bigger. Okay, starting from the left side here, active patients, age and immunization. So if you see here, for example, if I hover the mouse here somewhere, let's say here, this is age group 70 to 79, unvaccinated. And look at this drop down here, this selection here. This is the per 100,000 inhabitants active patients, so cases. not severe, not deaths, cases per 100,000. This is the rate, and rate is important because the absolute numbers cannot be compared unless the group sizes on both sides are the same, and they're not the same. So per 100,000 rate is actually, I think, a good way to look at it. And now let's just go here, 70 to 79. Unvaccinated per 100,000 cases, infections, 745.8. Vaccinated, and I assume here they're not saying one dose or two dose, they're saying vaccinated, and then they're saying vaccinated with booster. So when they're saying vaccinated, I'm going to assume that this is fully vaccinated. What I do not know here is somebody who is one dose and after, are they placed in unvaccinated or in vaccinated? I do not know that part. My suspicion is that they would have been placed in unvaccinated. So unvaccinated, 745.8 per 100,000. Fully vaccinated, I'm going to use the word fully vaccinated. I may be wrong here. They don't say fully vaccinated, but they say immunized without impulse. So impulse over here is booster. So I'm going to read it as fully vaccinated without booster. 620 per 100,000. Very similar to unvaccinated. We have done this discussion many, many times. We can't stop a virus from landing in our mouth. We cannot stop it from creating symptoms. It would happen. So you are seeing that the cases are present. And the number of vaccinated people are more and more. And as the society would interact, they would develop cases in vaccinated. This is like virus acting like a common cold. But we look at severe and death. Now, immunized with impulse, that is fully vaccinated with booster. And I'll show you the percentages of booster as well, so you could see what that percentage is. However, per 100,000, people with boosters, 77. Compare that to both other groups. Compare that to unvaccinated, 77 and 745, almost 10 times difference. Similarly, 620 and 77, almost 9-10 times difference. 9 times, 8 times. Still significantly large difference. And we have done this discussion as well before, that when a booster is given, or when an infection occurs, or when a dose is given after the first dose, that would act as a trigger for the immune system to rev it up and to cause it to become active. And when it will become active, you could have a fair question here to say, well, if we are saying that 2-dose vaccinated could get infection, nothing can stop that, then why are 3-dose not getting infection? Why are they stopped? And the answer is very, very simple. We have done this discussion in the past as well. And the answer is this. Let's say this is the oral cavity of a person. In this oral cavity, there are cells, correct? And then there is this mucus that is lining the oral cavity, right? So the fluids in our mouth, they are lining this oral cavity. What happens is, when our immune system is active against some infection, or let's say the vaccine dose is given, not the first one, second and third, then we are actively making IgA. And IgA is present in the fluids on our mucous membranes. That means in the nose, conjunctiva, mouth, other areas of which have mucous membranes. IgA is present there. If the quantity of IgA is more, then as soon as the virus lands in the mouth, it will get arrested fast. It would get coated with the IgA quickly. So the virus's chance to infect the cell and create a higher load to create symptoms will reduce. So those folks who have 3 doses, their third dose has revved them up enough, their immune system, that immune system is active. And if the virus arrives in their mouth at that time, they just take care of it very fast before they develop symptoms. And if they don't develop symptoms, they're not going to go and get their PCRs, and they're not going to appear positive. They actually may be getting exposed in the same way as other groups. If you just counted the number of viruses landing in people's mouths, or the number of people who are receiving the virus, all groups would have the same thing, unless they're wearing masks, or they're staying home, or there is a physical distance, or there are other social behaviors. But if they are behaving just the same, all the three groups, then they all are receiving the virus in their mouth or nose, or nose. The question is, whose immune system is revved up? Whose immune system is going to take 2-3 days to become active, and whose immune system is going to take 5 to 10 days? Unvaccinated, 5-10 days. 2-dose vaccinated, 2-3 days. 3-dose vaccinated at this time, almost immediate, but after some months, even that will go down. Immune system will once again reset, and then they would also will be in a resting state. So this actually makes sense, this data. So I'm going to see it once more. This is 60 to 69. Unvaccinated, 1,000 per 100,000. Immunized without impulse or without a booster, 611. Still very high number. Immunized with, see, the Google called it thrust here. This is also booster. So in 2 lines, booster is translated as impulse or thrust. So thanks to David helping me with this. Immunized with booster, that is 3 doses, 84 per 100,000. So significant difference. Will these 3 third dose booster folks have now immunity continuing for years? I think even the second dose folks would have immunity continuing for years. The important question to ask will be, when would their antibodies settle down as well? That is when they would either need a new booster, or their system would just behave so well when the virus arrives that within a couple of days, even with symptom, it would just like cold-like symptom, and they would take care of it, just like probably the 2 doses are doing. Now, the question in our mind should then be, what is happening to the folks who have 2 doses? Are they becoming severely ill, and are they dying? And what is that rate per 100,000? Again, if you wanted to look at this data, you can actually go in here. You can say, instead of active, seriously ill, you can say absolute numbers and so on. So now I'm going to switch this graph to seriously ill, and I'm going to keep it to per 100,000 because the rate is more comparable amongst the groups than absolute numbers. So seriously ill now. So these are the folks with various age groups: fully vaccinated, vaccinated with booster, and unvaccinated, and their serious illness and that rate per 100,000. So let's start from here. I'm going to go here first. This is 50 to 59. 50 to 59. This is serious illness. And whatever is the definition of the serious illness, do they go to a hospital or not? I'm sure they do. Unvaccinated have per 100,000, 72 cases of serious illness in this age group, 50 to 59. Immunized without impulse, I would call it fully immunized with 2 doses and then the protective time afterwards, 10. So between the unvaccinated, seriously ill, unvaccinated, and fully vaccinated, not 3rd dose, the difference between them is almost 7 times. And look at the last line. For this age group, with booster, per 100,000, 0.9. So almost 1 person. That is a huge difference. So I'm going to go to the other age groups here as well. So far, my conclusion, and again, you can say that, hey, this conclusion is not correct and I should have looked at it differently. My conclusion is cases are similar in vaccinated or unvaccinated. However, vaccinated become significantly better protected, even without a booster, from a serious disease. And with booster, their immune system is revving up. They are doing very well. Okay, let's look at some other age groups as well. Let's look at 90 plus. My problem is that, so I have to do this. So 90 plus, I have no idea exactly the count. So I'm going to leave it. Let's go here. 80 to 89. 80 to 89, unvaccinated, seriously ill, 167. This is per 100,000. So it doesn't matter it is out of 100,000 or out of 1 million. This is the rate. 167 per 100,000. Vaccinated with 2 doses, 75 per 100,000, half. Not 10 times like before in 50 to 59. At this age group, half. And then with booster, 11. So 11 per 100,000 versus 167 per 100,000. So that is 10, 13, 14 times difference. I wish I could look at this 90 plus as well. It just keeps cutting it when it goes there. Maybe I can reduce the size and see it. So give me 1 second. When I play with the size of these charts, the whole thing just becomes messed up. So don't mind. Still the same. Okay, so 90 plus. This is active patients. Let me see. Seriously ill per 100,000, 90 plus. Unvaccinated, 90 plus, seriously ill. Unvaccinated, 192, 90 plus. Fully vaccinated, not 3 doses, 2 doses, 35. So almost 6 times difference per 100,000. So this is an effect of the vaccine. And then 3 doses, 14 versus 192. So almost 14 times difference. This is in the age 90 plus. This is a very important difference, and it is right here. The reason I'm doing this is there are so many rumors that somehow vaccines have not been working, somehow vaccines are not showing effect. Look, I think I have always been in this position to say ivermectin works, vitamin D's and those things work. I've done lots of discussions, and I've always said that the vaccines work as well. So here vaccines have side effects too. And I have always maintained that we should figure out what are those side effects. How do we see the indications of those side effects? And then how do we make protocols to manage them? Or how do we guide the people to say, under this year, let's say 50 years and below, women don't take adenovirus-based vaccines. So I've done those discussions before. Here, I think it's a very decent result. Look at this one, 80 to 89 we saw, 70 to 79. This is seriously ill per 100,000, unvaccinated 150, immunized without the, this is Luffy curling outside. Give me 1 second, please. Apologies. So Luffy nowadays likes to stay outside, so I think he's quarreling with some other cat. So my wife went out. Okay, so 70 to 79, unvaccinated 150, fully vaccinated 58, and then with booster 3.9. So again, the difference is quite evident. 70 to 79, fully vaccinated, almost 3 times less severely ill, and with booster 150 to 3.9, almost what? A lot of difference. Sorry, I got distracted by Luffy. Okay, so this is one. Now I want to look at the Deaths as well, unfortunate thing, but look at that too. So before we go there, check out this graph. This graph shows the number of the percentage of people who are 3-dose vaccinated versus 2 versus, so here 90 plus, 1 dose 82.9, 2 dose 79.7, and 3 dose 64.7. So when we looked at the 90 plus results, here 64.7 have 3 doses, 64.7% have 3 doses, and you saw that the rate is really low. And so you can look at the other age groups here as well. I want to see if and look at the R naught. R naught is the reproduction number and how fast if the disease is spreading or is stable or is reducing. If it is greater than 1, the disease is still spreading. If it is at 1, that means disease is stable, not increasing, not reducing. If it is lesser than 1, that means disease is wrapping up from the society. So here, if you see, the R naught is 0.83. It has actually plummeted before 1, under 1. So the date is Thursday, 8/26. So after 8/26, the R naught has reduced below 1, which is good. Okay, so now continuing. So recoveries and deaths. So this is the folks who have unfortunately passed away and their immunization status. So if you see here, once again, not immunized, not vaccinated, vaccinated with booster, without booster. And let's look at some of the data here. Let's start from here. We look at similar looking numbers and different looking numbers. So this is 9/6. Today is 9/9. So this is 3 days ago. This is number of deaths. And I believe it is per 100,000 rate. So if you see here, per 100,000 and age over 60, you can change it to age under 60 and then go from there. And this is for last month. So I'm going to keep it this way, age over 60 rate, and then let's look at the data. So here, come on. Okay, so Monday, 9/6, September 6th. Deaths amongst unvaccinated, 12. Fully immunized, that is 2 doses, 5. So almost 2.5 times less. And 3 dose, 0. You saw that the number of people with 3 doses is significant. So it is not that the group size is small enough that they're not getting enough infections and they're not getting severely ill and they're not dying. A lot of people are boosted with the 3rd dose. And so number of deaths are 0. There is a protection there. Now let's look at similar looking numbers. Here on 9/5, a day before. And we realize that the deaths do not occur for the same day's cases. This is 3 weeks, 4 weeks, 6 weeks, 8 weeks ago, the patients who were hospitalized at that time, at some point, they might pass away, unfortunately. And this is that. So this is not a one-to-one correlation with that day's cases. So these folks who are dying here, they may have been here 4 weeks ago, 6 weeks ago in the hospital. Unvaccinated, 4.1 per 100,000. So this is not the absolute number, this is the rate. Immunized without impulse or without booster, 2.8. So half. Not half, 2.8, 3. So almost 3/4. If unvaccinated are 4, then the other one is 3/4, 3. and immunized with booster 0.5 per 100,000. Let's look at some other numbers too. This is a number that is, I don't know why it goes to that side. Give me a second, I'm going to reduce the size. So here, this is the chart. So let's say if I go here, this is another number, higher one for the unvaccinated. Unvaccinated, this is 830, so August 30th. Unvaccinated, 11.2 died per 100,000 over the age of 60. Immunized without boosters over the age of 60 per 100,000, 2.7. And with booster over the age of 60 per 100,000, 0.2, which means 1 person out of 500,000 might die if they have a booster. So that's a lot of protection. Let's look at another close by data. So let's say this 827. Unvaccinated 3.9, or let's say 4 per 100,000. Immunized without booster 2.2. So more than 50% the difference between them. And immunized with booster 0.2. So a lot of difference. And my conjecture here will be the following. I would assume that majority of the population is getting third booster dose now. That means they will get another 4 to 6 months window where their immune system would stay revved up and they would stay protected. Then it is possible that the immunity wanes again. And I think at that time we'll have more data to figure out, will they get more boosters, or this booster was sufficient to continue for a longer period of time. So this is the discussion. What do you think? I deliberately did not look at the absolute numbers because then I have to normalize them for the groups. And this per 100,000 is a similar thing. It's a normalization. One last thing, which is a curiosity for me, and I'm going to just, I hope I don't waste your time. How about people up to 60 years of age? What are their dynamics? So this is 60, under 60 actually. Not vaccinated, vaccinated with 2 doses and booster. So let's pick up any time. This is 831. Unvaccinated, under age of 60, 0.1 deaths per 100,000. So that would mean, so 0.1, that means 1 death under 60 unvaccinated per million. Now, immunized without booster or with booster under 60, immunized 0 deaths. Let's look at this here, 0.1 unvaccinated, 0.1 fully vaccinated, and that is equal. 1 out of 1 million, 1 death. And with booster, nothing. What is this pulse here? Does it say 0 for all? This is immunized with booster 0.6. So I think the numbers are so small that there is no real pattern here. So that was interesting for me to look at. Another thing here, if we see, this is the acute patient. So I'm going to go to seriously ill, 100,000. I wish they had I think they have the group here. So let's go below 60. So 50 to 59, we saw that, 72. Now we're looking at the seriously ill per 100,000 and lower age groups. 50 to 59, 72 in unvaccinated per 100,000, 10 vaccinated per 100,000, so 7 times difference. Or is it 8 times difference? 7 times, I think. And then 0.9 per 100,000, which is huge, 72 times different. So as the age continues to be younger, the ratios continue to become different as well. So here, this is 40 to 49. I'm hoping it shows me the numbers. 48, 2.1, and 1.2. Okay, so 40 to 49, unvaccinated 48.9, fully vaccinated 2.1, and with booster 1.2. So 48, 2.1, 1.2, 40 to 49 years of age per 100,000. So once again, 48 versus 2 or 1. Then if you go to even younger age group, 30 to 39, unvaccinated 15.3, are they seriously ill? Yeah, seriously ill. These are not deaths, these are serious illness. So 15.3. Then in the immunized, in this age group, 0.7, 2 doses. And 3 doses, nothing, 0. 20 to 29, 6.1 unvaccinated, serious illness, 0.1 fully vaccinated and with booster, nothing. I think similar pattern in other areas too. And if you see in the younger groups without vaccination, even the rate is reduced. So for me, this is not a display of vaccines not working. I know that the comment will be, well, the 2 doses did not work. I think that it is interesting that with the 3rd dose, their difference is drastic. What will have to be observed is what will happen after 5 months or 6 months when the antibodies wane again. Okay, so this is the discussion. I thought that this was interesting to talk about as well. Let's just see a quick few comments. John Snyder says more than 75% of adults in the US already had at least 1 shot. That's very good. So TigerX966 says, seems the vaccine produced variants are doing as planned, attacking and killing younger and younger people. The vaccines are the vehicle used to spread COVID-19. That's not correct. The whole statement is entire statement is incorrect. Number one, vaccines do not produce variants. Whoever gets infected, vaccinated, not vaccinated, previously infected or not, we all can make variants. And I had seen Rima's comment that, can I explain how the variants come together? So maybe tomorrow we only talk about how variants are produced, regardless of who we are, vaccinated or not. And then the other part, the younger and younger population that is getting affected is because the other population, older population, is becoming vaccinated. So wherever the virus is going to find empty bodies, that is immune system not attacking it, that is where the virus is going to spread more. So that's also not a vaccine caused thing. Vaccines are the vehicles used to spread COVID-19. No, that's not correct. Gold Country says, life is hazardous for us geezers. Gold, I hope you're doing well. V says, I love this guy, but his accent is a little difficult. Do you know that I actually don't even hear my own accent? It is so strange. When I'm speaking, I feel like I'm speaking quite well. So apologies for this. David says, vaccine will activate Bell's palsy. Stay away. We need to band together and everyone walk off the job. See what that does to America. Vax at Biden's schmuck. So no, yes, this is true that sometimes in people, vaccine does cause Bell's palsy. But no, it would not activate Bell's palsy in everyone. If that was the case, you think that vaccines will be given in such large numbers and still continuing to be given if Bell's palsy was occurring and if that was a permanent damage? Gilidoni says since last night, do you think third dose, good 50-year-olds, is a good idea? So it's the age that makes the difference, but last night didn't matter age or comorbidity. Giladoni, what do you mean by last night? Did we look at some other vaccine efficacy last night? We can probably look at it once more, but here we are looking at Israel's data, and the presentation is based on their data. I actually think, so some of my friends, my class fellows, they are saying that, hey, we're asking, my parents both have passed away, but they're saying, hey, we're asking our parents for the booster doses. And it makes sense. You could see this data. Andrew says, I don't trust this data. It's rigged. Israel made a deal that Pfizer takes care of that stats. I don't know if such a large scale of rigging can occur. What would Israel get with that? Kelly says, also curious about the comorbidities in that 1 out of a million under 60. So in the previous studies, so here we do not have comorbidities data. In the previous study, I did a study from UK where they had seen the vaccine caused serious illness or death in children. And all who died, I believe there were 14 or 15 children's death in the cohort that they studied. And all of them had some comorbidities. Majority of them had, if I remember it correctly, terminally ill or those comorbidities that would cause terminal outcomes. So Rambling Rose says, when did Israel get their third dose? They have been on third dose for some time now. Look at the numbers we just saw, that their majority of their populations, if I very quickly share my screen once more, look at this chart here, 90 plus, 64% third dose, 80 to 89, 74%. And so these blue bars are the third doses. They have covered a lot of ground with the third dose as well. Westfield says, geez, the basement dwellers are out. So K. Kalo says, no large-scale rigging. How can you say that considering what they're doing with ivermectin? So you are correct for ivermectin here. See, the thing is this, I think what you're implying is that if they can discredit ivermectin, then they're rigging the data to give credit to vaccines. I believe that there is a intentional and concentrated effort or concerted effort to discredit ivermectin. I totally believe that. I don't believe that they're trying to overcredit the vaccines. I just don't think they can produce that kind of a data. So how about we do this so that this chat doesn't become too long and too cumbersome. Gavin says, hi, Dr. Bean, why do you think a large proportion of your viewers, or at least commenters, seem to be anti-vaxxers? I'll tell you this. So since the beginning of the pandemic, when there were no vaccines, we grouped together, regardless of what a person believed about vaccines, or what was their religion, or what was their politics, or what was their race, gender. We just started looking at mechanisms of various products that could help us be more protected. And I had been very, very clear that for me, I'm not going to sit here and criticize anyone who does not like a vaccine or anyone who likes a vaccine. And I had been also very clear that I myself am a pro-vax person, and I would wait till the vaccine appears. And when it would appear, I will take my vaccine. And I find this incorrect for the other folks who are pro-vax, I'm saying this in quotations, that they get their own vaccine, but for others, they continue to say, well, vaccine is a bad thing. So I've always said vaccine is important. And till the time we have them, the bridge is going to be all of the other things. And I think I'm one of the most prolific presenters about other possibilities as well. Now, as the vaccines came about and they became a reality, I took my vaccine, my family took their vaccines. I talked about the side effects of the vaccines. I talked about the clottings, myocarditis, and so on. And so now the group, the folks who are around me, they are clearly divided in two groups. One is a group that believes in vaccines, and then there is a group that don't believe in vaccine. They don't like vaccine. There are so many reasons they have as well. And both kind of folks are offering their comments. I actually tried to stay neutral in it, but I'll tell you, it is a very interesting thing. Majority of death threats given to me, and I've been given very graphic death threats, were from folks who did not like vaccine. And how do I know that when I would do something which would say, hey, vaccines are useful, just like today's discussion, then I'll get a lot of death threats as well, and I could connect the dots. Majority of my issues where people created legal issues for me are by pro-vaccine folks who thought that when I criticized a vaccine, or I said, here is a clotting, or here's a myocarditis that can occur, and they wanted me to not talk about it, and I refused to stop from talking about those things too, they created a different kind of set of problems. I received both ends heat. But I still feel that this was important to neutrally present this for the benefit of everyone. Having a correct vitamin D level is important for someone who likes a vaccine or does not like a vaccine. Keeping your diabetes under control is important for someone who likes a vaccine or does not like a vaccine. I tried to do this kind of a service where I offered as much help as possible to all. I have received a lot of negative outcome of that, including this kind of a comment that you just made, that somehow you implied that it is my commenters who are saying this because maybe I caused something here. So that's not correct. And I have always been very clear. I would offer my help like a book. So the books over here would not care you like a vaccine or not. They would present you the information. And I have always been very clear as well that I would not ask you to go take a vaccine or not. I'll just tell you what I did. I took a vaccine, and I have videos of when I took the vaccines. Okay, so Jason says, I really like your perspective, which is well balanced and makes sense. Thank you. Thank you very much. And the way to understand it, many folks struggle to understand what is my position because they are looking at me from, let's say, Republican point of view or a Democratic point of view, Democrats' point of view, or pro-vax point of view or anti-vax point of view. I have kept a point of view of being what is a doctor's role? When you go to a doctor, should the doctor ask you that, are you a Republican or a Democrat? Are you, do you like religion or not like religion? They cannot, they should not. They should see how to protect you. That should be the intention, regardless of who you are, what your beliefs are. That is what I tried to do. I tried to be the book. And I got a lot of a lot of punishment for this. And I sometimes feel that if I had taken, nowadays with all these people creating legal noise and creating death threats and those, I feel that if I had taken a position, let's say pro-vax, because I would never take an anti-vax position, if I had taken pro-vax and became a group of that, part of that group, I may have only gotten folks around me who liked vaccine, and all that extra heat I would not get. But I tried I tried to, it was not this that I was trying to please everyone. I thought during the pandemic we have to be exceptional to be able to offer value to as many as possible. I used to say very commonly that once the pandemic is over, we can go back to our belief system and do whatever we believe. But this is a time when we have to be exceptional and we have to serve. We have to protect each other. Okay, so long chat. I also used to say that this should have happened by our healthcare leaderships. It is a vacuum of the leadership that has caused folks like me to come up and offer help or education, information that can be then used. It should have been at a higher level. Okay, so many words. Let's see, copied often. T-cell exhaustion, issues with an overstimulated immune system. Also, your thought on stress granules regarding mRNA inheritance. Thank you. So yes, there is immune system cell exhaustion. What happens is that when the cytokines are too many, those would continue to cause these cells to function. One, that causes the depletion of their granules or their weapons inside them. Secondly, normally a cell is supposed to die, a new cell is supposed to be created for the blood cells or the immune cells. When you keep a cell engaged, that cell refuses to die and it keeps fighting. This is like, when the soldiers are on the battleground, even when they're wounded, they're still fighting. And if the same person, if you take them out of the battleground and put them somewhere else, maybe the wound would make them disabled very fast. So it is that passion that continues to work. That is the same thing with the immune cells as well. Just like monocyte carrying S1, they don't die, they just keep on fighting. So because of that, what happens is that those cells become exhausted. They do not have the right function in them. They become aged very fast and they cannot function correctly. They're not properly flexible anymore. They do not have the right number of granules in them. They do not have correct enzymes that are functioning correctly. And so we have made them old and we keep asking them to function like a young cell. They cannot, and that is how the disability appears of the immune system. So the best thing is to kind of let the cells cycle. Now the stress granules, I have to read a little more to understand that. Rick Ortega says, isn't the spike protein produced by the vax different than the spike protein from the live virus? Yes, in some vaccines, not all. And if Doug is here, he can tell us which vaccines. Majority of the vaccines that produce a spike protein, they have spike protein modified to lock it, number one, and number two, to maybe increase its longevity, its life. But they cannot make it too different, because if they make it too different, then our immune system would learn to attack it. And now when the actual original spike protein comes in, immune system may not even recognize that if this spike protein generated by the vaccine was too different. So they still have to be very, very similar to the original. And so then you say that I read that the vax produces sp2 mutated spike that cannot enter our cells if vax spike leaves cell. That is correct. So that is the locking of it, which allows it not to open up. And so when it does not open up, the remaining system does not engage. Ideally, a spike protein would open up, and then the S1 separates and S2 separates, and the open set parts would then go and fuse with the cell membrane. Most of the vaccines produce spike proteins that are locked, and they cannot do these things. So V says, when will nasal vaccine be available? I think that nitric oxide is available, which is not really a vaccine. There are vaccines, but it seems like to even offer a vaccine, one has to be a powerful company. Rima says, let's get the chart out so people have something to refer to. You are the book and you are exceptional. Thank you very much. Yes, I think, Rima, we should continue to work on that. I was a little distracted in the last few days, but we should continue to work on that chart. So we are talking about a chart for what vaccine, for which age group, gender, race, works, comorbidity works better. That is actually Rima's project, and it's a great project. C. Lear says, you need to change your name to Frank Bean. Sure, you are frank with us, and both groups should appreciate that. Thank you. I have attempted not to intentionally discredit any one group, but people become upset with me. There was a time when anti-vaccine folks became very upset when I criticized Geared. Then there were times when pro-vaccine folks became very upset when I criticized Kentucky study. I believe that majority of my current noise that people have created in my life is after those couple of events. K. Carlo says, new 900-page documents found that implicates Dr. Fauci to Wuhan lab funding. The people against lab leak hypothesis all seem to also be pro-vax. This is scary. I don't trust these. So I am a pro-vax. And so let's say we take your statement and apply that to me. I have maintained that the lab leak part is something I do not know. I do not know the virus is built in home in some lab or not, by humans or not. Is it modified by humans or not? Is it a gain of function or not? I just do not know that. So because I do not know that, for me to say it comes from the lab or it does not come from the lab is kind of totally wrong either way. I have no idea. So what I did was, I tried to focus on the things where I could bring some information that can be valuable for folks to be able to better navigate this time. More information, more education. Really, I drew cartoons of the studies. That's what I did, in a hope to illustrate and clarify or make it accessible, the medical jargon. That's all I did. So I never had the intention to look at the remaining parts of the conspiracy, or maybe somebody is aware of these facts. I'm not. So this is why, at least my position is, I have no idea. Cool. So here we are. The Novavax is kind of scary. Okay, so here I saw a comment that I was going to click on, and then it scrolled up. Yeah, so here I can't find anything regarding Novavax. That is the sad part. Novavax is such a nice vaccine, and they just don't seem to be able to make progress. Cool. So, Cool Beans, thank you very much for today. Thank you very much for being around me as well during this time, being with me during the scary times, and nowadays during these little bumpy time. Thank you very much for being here. Thank you for your time. Thank you for your support, your friendship. Thank you for navigating this time with me. Please take care of yourself. I would see you tomorrow. Let's not do a more chit chat today. And I wanted to make sure that these two topics are taken care of. So please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can buy me a coffee, or you can become a patron, or if you don't mind PayPal, you can use PayPal as well. So thank you very much, and I would see you tomorrow.